Headlines on this Tuesday, April 28th, 2020.
2,000 tests performed and only 315 positive cases. 315 is the lowest we've had in weeks.
Good evening. In his daily briefing, Governor Ned Lamont highlighted numbers that continue to trend in the right direction. Here are the up-to-the-minute numbers for you. The state has now more than 26,000 confirmed cases of COVID-19 since the outbreak began. There are currently 1,732 people in the hospital. That is 26 fewer than yesterday. And as that number continues to decrease, the state is working on how to go about reopening our state. One of the keys is contact tracing, determining who had the coronavirus and who they came in contact with. Channel 3 Eyewitness News reporter Matthew Campbell is here now with more on how that will be done. Matthew?
Yeah, Dennis, this is very much the old school way of tracking, at least for now. And this is how it's going to work. When someone tests positive for the coronavirus, they're going to be contacted by the state or local health department. They're going to be asked to fill out a questionnaire. For example, they want to know where you've been and when you were there. And this is completely voluntary, but it's going to give the state the ability to find out where this person is going and who they're coming in contact with. Now, this method of contact tracing has been used for years, especially when measles was a big concern. Right now, 300 people are participating, and the state is looking to roll this out widespread by the third week of May. Critics are concerned about privacy, though, because there is also technology that's a little more invasive, where tracing happens via Bluetooth on your phones. The state is not using that, at least not yet.
These are new technologies which may be available in May, and I think we'll have to see how those become layered on top of our existing system. Our system that we're using is the traditional contact tracing system, but these newer systems, like the Apple-Google proposal, will provide aggregate information to systems, but not that same level of information. So we need to figure out how people will choose which of these systems they decide to participate in.
And again, Governor Lamont says this is voluntary and the information will be handled by the state and local health departments. It's going to also be shared with New York, and New York in turn will share its data with us. Live above the newsroom, Matthew Campbell, Channel 3 News.
Okay, Matthew.